Gurmagat for Hirluk and Gurmagat for being here this morning. I'm so angry this morning, actually, and it's right on topic. So you're talking about that early intervention that's needed, and we really need to increase the resources, especially when we look at in the dental area. We need to improve training. I'm working with a constituent at the moment whose child has been on a dental waiting list for years, because he already has problems and he's on that waiting list for years. And they contacted me on the 8th of June because, the mom had noticed his behaviour was unusual for a couple of weeks. The child is non-speaking, so it's difficult to ascertain what's the matter. And by the time she eventually was able to look inside his mouth, she realised that there was, a flap of gum hanging down. So by the time they get to the dentist, of course, the child isn't going to want to let the dentist look inside the mouth. He finds it difficult to sit in the chair. The mom knows this. The mom knows from the get-go that he needs to be sedated and brought into the hospital. But you have to go through all the steps of book the dentist, go there, have an unsuccessful appointment, and then try and get on an emergency list. So from the 8th of June, they're on an emergency list for dental treatment, and he today has finally got his appointment for the 24th of July, and that's with the intervention of a TD. So this is what we're dealing with. So what's his mouth going to look like in 20 years' time? So I think the training is needed for our dentists to be able to listen to our parents, and then we also have to increase resources, in that area. But on the positive then, I'm wondering on some of the positive things that we're seeing in early intervention now. I think of Variety, the children's charity that are bringing in those adapted trikes and adapted bikes, the GAA Sport for All. We are starting to move away from the disabled group and the additional needs group. They go for a walk, or they go bowling, or they walk to the shop and they get a treat, or they go to the chip shop and they, hand over their money and they get chips. And that was all well and nice, but we are starting to have real inclusion. I think of Queenshoe in Mayo, which is like the adapted version of Coltis, where a little girl, Hannah Dunford, asked her parents, Chuck and Mairead, on the way home from a fla, when will I be able to take part in the fla? And so they made this now inclusive Coltis, which is called Queenshoe, where it's about people with additional needs being able to fully participate in music, song and dance. So we are seeing improvements in inclusion for cultural aspects, sport. How long do you think that those kind of improvements will take to translate into the IDS tilde in terms of chronic illness and outcomes?
Yeah, well, I think they're to be warmly welcomed, and we see that, and we see pockets of that, and that much more inclusive, like the GEA, like all of these things happening. I think I suppose we are looking at an older population, and we're interested in enrolling people younger, and then we can see the change. I think we need to work with the age-appropriate groups in society to make them accessible to people with intellectual disability as well. So the cafes that are out there, the Alzheimer's cafes, the wellbeing cafes, the other fitness clubs that are established throughout the country. We need to prepare and enroll people and support people for people with intellectual disability to engage in them. But I think we have a bit to go when it comes to the older population yet. And just to go back to your point on dental, I mean, that is a tragedy. We're working very closely with the Dublin Dental Hospital, and there is an absolute need for special care dentistry for this population. And without that and having access to this specialist type of expertise, including the environments and the preparedness of the environment when the like of that young boy comes into a dental hospital for care.
Especially a lot of the children I would have worked with, the capacity to sit and wait in a waiting room for 20 minutes, is not there for so many kids. But there are good news stories too. There's a fantastic dentist in Castlebar who used to see one of the kids that I worked with every 6 weeks. He didn't need to see him every 6 weeks. What he allowed him to do was come in, sit in the chair. He used to put a bit of rinse in his mouth and let him out again. And so that then if there was an issue, he was used to coming in and there was no problem. And he put him first in the morning because he knew there was absolutely no capacity for him to wait. And I think when there is training and that's all it is, it's training and education and environment, there can be wonderful outcomes. But that switch into meaningful inclusion is probably the biggest thing that we can do in society. As you talked about the gyms there.
Yeah.
And, there's a huge cohort of teenage children with intellectual disabilities that aren't brought into the gym to meet with personal trainers, but again, they are going, when they go out for the day, it might be going down to the bowling alley to take part in bowling and get chips, which they love. But if they're already suffering with a little bit of obesity, that's not going to target that issue.
Yeah, exactly. Leisure competence is a skill, and I think we need to start with children early to develop leisure competence and sporting competence when they're young.
Change of mindset. So I think when you say about going out, but something that used to really frustrate me was particularly people with intellectual disabilities being driven around the place in cars to go and access. They should be supported to become, to develop the skills to use public transport where it is available. So I think that's something, and then that starts to give different life skills. It increases, activity, and it's not, because that was one thing I always used to come into my head. So why do we are obsessed around driving people with an intellectual disability, whereas this should be supported. If they are going to get a takeaway, whatever, going to the bowling alley, whatever they're going to do, is to support them in terms of, because until society sees people with an intellectual disability as having this level of competence, and that they're socially valued members of society. We need to start ingraining that within society. And when we see people that contribute, that they've got this social competence, that then we start to change the mindsets, and that people with intellectual disability become more ingrained and visible within society. And that's, I think, the point that you're getting at is where we need to go. And we are seeing that. We absolutely are seeing that. But I think we need more visibility, more integration, that we see that people with intellectual disability are competent the same as you and I were, and then we start to change people's mindsets.
I'm sorry, Chair. The advocacy groups are going a long way towards that. There's a Mayo advocacy group who are engaged on a number of times, and being able to use their own voice to say what they need is so important, because when somebody, who you would traditionally have experienced them being in the institutions of the past, or going to a day service and maybe getting out now and again, when they're telling you, I want to be able to access a bus, and I want to be able to go to the cinema, and I want to be able to have a meaningful job, that's different than you and I trying to advocate on behalf of people with disabilities. Grandma, I got you.